Hello, I'm Dr. Ranjan Kamilya, consultant orthopedic and joint replacement surgeon at Apollo Multispeciality Hospital. Today, I'm talking about knee replacement, especially partial knee replacement or unicompartmental knee replacement, which is commonly known as UKR. It is slightly different from total knee replacement, which is called as TKR, in the sense that we are just replacing only that part of the joint which is damaged. Previously, for any knee osteoarthritis, even if there was a single compartment disease, we used to just replace one part of the whole knee was replaced. But nowadays, if there are certain conditions where we can exclude that there is no ligament injury and the other compartment is fine, then we can just do a partial knee replacement or an unicompartmental knee replacement.
My name is Mr. Ayekyawtmanag. I come from Myanmar. In Apollo, only 5 days. In the hospital, all complete for me. I am very comfort and very pleasant.
The one which you're talking about, he was an international patient from Myanmar. He's 70 years old. He had osteoarthritis in both knees. Initially, we had planned for bilateral unicompartmental knee replacement. But inside the OT, we did one UKR. The other one, we saw that there was a deficiency in the ligament, that is the anterior cruciate ligament was not functioning well, and even there were some changes in the lateral compartment as well. So we changed our decision from UKR to TKR. What is UKR is, if I show you, this is total knee replacement where the whole joint has been replaced. This is the artificial joint. Where in unicompartmental knee replacement, only this part which is damaged has been replaced, and the other compartment which is normal, we are preserving that, provided the ligament which is inside the central ligament, we also call the anterior cruciate ligament, is functioning well and the lateral compartment is fine. The advantages of unicompartmental knee replacement, it gives more like a natural knee because the ligaments are preserved. So it feels like a natural knee. Our patients who used to get total knee replacement, their main complaint was that although there was no pain while walking around, but they used to feel there is a different type of knee. It's not like my own knee. That was the patient saying, that is not my own knee. But because the ligaments are preserved here, we are getting a more or less normal functioning knee, and the patients are allowed to do anything. And it is, you can say, it is a much more friendly for the patient. It is very comfortable. Patient can get back to normal life within 3 to 4 weeks. That is the beauty of this operation, because there is less invasion of the soft tissues also in this one. That is the unicompartmental knee replacement. So if you see the post-operative rehabilitation procedure, that's within about 4 to 6 weeks, they are more or less going back to normal life. We keep the patients in the hospital for 2 to 3 days when they start working. Even with bilateral knee replacement, they don't need a support after 1 week to 10 days. That is the beauty of this operation. So in patients who definitely fit the criteria for a unicompartmental knee replacement, they will do much better than a total knee replacement. Even in bilateral knee replacement, patients can get back to normal in very short time. Thank you very much.